Hello and welcome to my channel. This is Isaac Simpuenre. Karibu sana to my channel. Uh, there has been several things that have been happening in our country. Some of them are economic, others are social. But now, when it comes to health, we must not ignore it and we must take it very seriously. And some few days that have passed, we had there's some outbreak of a certain disease that we call Kalaazar in the county of Marsabit. And I thought it is very wise for us to be able to discuss it so that we can be able to understand what is Kalaazar and what causes Kalaazar and how can it be treated or how can it be prevented. Thank you. Kindly remember to like, subscribe, and share to my channel for more of my videos. This is Isaac. In this channel, we talk more about HIV, prevention of HIV, and we always say that being HIV positive, being positive about HIV is not necessarily being HIV positive. And together, we can be able to avert HIV stigma. So, today we'll be talking about a parasitic infection that we call leishmaniasis. Someone may ask, what is leishmaniasis and how does it concern us? Now, leishmaniasis, this is an infection that is usually caused by genus Leishmania. Leishmania, this is a parasite. Usually, it is transmitted by a vector that we call a phlebotomic female sandfly. And Leishmania has various species, and one of the species I'll only highlight two because there are almost about 20 that causes Leishmania infection in human beings. And we have Leishmania donovani, we have Leishmania mexicana. These are the two that are the major ones that cause Leishmania infection in humans. The others are mainly subtypes of these two main species. Now, how about leishmaniasis? Leishmaniasis, there are various forms of leishmaniasis as they present in the human body. And basically, we have three forms of leishmaniasis presentation in human body. One of them we call visceral leishmaniasis, which we shall be able to dwell with it more in our topic today. And this is what we call Kalaazar. The other ones we have cutaneous leishmaniasis and mucocutaneous leishmaniasis. Thank you. Now, these are the main presentations of leishmaniasis in the human body. And when we dwell much or when we focus much on Kalaazar, now the one that we had from our televisions, from our radios, that is presenting in the county of Marsabit. Now, someone may ask, what is now the Kalaazar? And Kalaazar, we also call it visceral leishmaniasis. This is the most common presentation of leishmaniasis, and it is the most severe and the most fatal if non-treated, and that's why it becomes our main topic today. Now, what are the signs and symptoms of visceral leishmaniasis or Kalaazar infection? When you get an infection of leishmaniasis, that is visceral leishmaniasis, you may present with high fever. Your spleen may enlarge, and this enlarges gradually. Then you may have hepatic enlargement or liver enlargement. We also call it medically hepatomegaly. The other presentation, you may have enlarged lymph nodes, or we also call it lymphadenopathy. We also present with anemia, and this anemia is much severe that it can cause congestive cardiac failure or heart failure in other terms. The other one, you may present with blackish spots or blackish discoloration on your skin. And the other one, you may present with thrombocytopenia. Thrombocytopenia is low platelet count, and this manifests in your body when you start bleeding from the eyes, bleeding from the nose, because the platelet count in your body is very low, severely low. The other one, you may develop hypoalbuminemia. When you have low albumin in your blood system, it affects your osmotic and oncotic pressure, and this will manifest by having swollen lips, because the absorption of the fluid after the extravasation or after ultrafiltration, when you are feeding your cells, fluids exit from the cells, from the blood system to the cells. Now, returning that fluid from the cells or from extracellular space to the blood system requires a lot of albumin to create oncotic pressure to be able to pull back this fluid back to the blood system. Now, when you have low albumin in your blood system, the oncotic pressure is affected, and this leads to a lot of fluids remaining on the extracellular space, which is not necessary for the cells. This causes your cells to swell, and also your extracellular space will also swell, and this we call it edema, or usually presents on your limbs. So you will have your lower limbs or your legs swollen. The other presentation of low albumin or hypoalbuminemia is having fluids in your belly, or we also call them ascites. You may present with a puffy face. We also call it anasaka, or puffy face and the whole body swelling, we call it anasaka. Now, with all this, it is as a result of hypoalbuminemia. And why hypoalbuminemia? This is because your liver was affected. And when your liver is affected, it results to, or it will lead automatically to low albumin in your blood system. Now, what are other presentations that this person may present with? The other presentations, rather are general presentation of a sick person, are severe wasting, and also something else that is synonymous with HIV in this case is immunosuppression. And someone with the Kalaazar infection who develops this kind of immunosuppression may develop other OIs or other opportunistic infection like tuberculosis, pneumonia, dysentery, that is bloody diarrhea, and others that we may not exhaust them with this topic of today. Under this condition, presenting with these various signs and symptoms may not be pathognomonic of Leishmania infection or Kalaazar infection, and therefore it is very necessary, even if you present with all these signs and symptoms, it is very necessary for a healthcare worker to be able to do investigations. And what kind of investigations do we do when you visit a healthcare facility? One of the investigations we do is full hemogram. Why full hemogram? When doing full hemogram, you'll be able to detect pancytopenia or low cell count, that is uh, the parameters that we do for full hemogram, that is platelets, that is white blood cells count, that is the red blood cells count, are usually low, all of them. The other thing, this pancytopenia usually associated or comes along with the granulocytopenia and monocytosis. This can be easily be understood by medical staffs, but I'll make it easier for us to be able to understand. When you are tested full hemogram at the health facility, the parameters will be very low, and the healthcare worker will be able to explain to you that they appear severely low, all of them. Not one of them, but almost all of them appear a bit low. The diagnostic test that we do for this, then we may also do Leishmania antigen skin test. For this one, when someone is clinically very ill with Leishmania infection, or rather we can call it Kalaazar, they are allergic to Leishmania antigen, and usually this test is not usually done immediately, but after initiating to treatment, this test, after being tested, it will turn positive. At this time, the allergy will have subsided. The diagnostic criteria. How do we come up with diagnosis of Leishmania infection? Now, when we do microscopy, we'll be able, or maybe a smear for microscopy, we'll be able to identify, or we'll be able to demonstrate mastigotes in splenic smears, and this is pathognomonic of Leishmania infection. The confirmation of mastigotes in splenic smears is diagnostic of Leishmania infection. The other thing, we also call it positive Buffy or positive Buffy coat smears, and this one usually is a diagnostic of people who are severely immunosuppressed. They may present positive Buffy coat smears. Now, let's proceed. Initially, we were talking of Kalaazar infection, and we have talked about how it presents, how do you make a diagnosis, and we have said that making a diagnosis of Leishmania infection, you have to demonstrate the mastigotes in the splenic smears. We have also said for those who are severely immunosuppressed, we may do a Buffy coat smears, which usually turn positive. Now, this is diagnostic. Now, someone may ask, how do we come up, or how do we offer treatment, or what kind of treatment do we offer for persons who are suffering from Leishmania infection or Kalaazar infection? There are two modes of treatment. One is the historic treatment of Leishmania infection, and the historic usually use the pentavalent antimoids, or you can also call it sodium stibogluconate, which usually is given as 100 milligrams per ml. Then we have the amphotericin B. This is the amphotericin B that we usually use for the treatment of cryptococcal meningitis. It is the same one. And how do we offer it? Usually give it as 0.75 to 1 milligram per kg body weight and is usually given 15 to 20 doses. It may be alternated in days or given on daily basis. What are the differential diagnoses of of the now the this Kalaazar infection or visceral leishmaniasis? There are various differential diagnoses, and one of them may be severe malaria, may present the same with high fever, uh, enlarged spleen, enlarged liver. Then we have typhoid infection. Then we have tuberculosis. Then we have neoplastic conditions. These are malignant cancers presentation. Malignant cancer may also present with immunosuppression and also severe wasting. And this comes to the end of our topic today. Thank you for watching my channel, and thank you for being consistent in watching health education in my channel, Puma Health Solutions. I will be presenting more of this, and as we also continue learning more about HIV, about prevention of HIV, about treatment of HIV, and about living positively with or without HIV. Thank you, and God bless you. And also, let us be able to learn more as we continue subscribing to my channel. Let more people be able to know more about HIV. And also, like for today, a different topic, that is visceral leishmaniasis. That is something that is now upcoming and now in our country, and which we should be able to understand as Kenyans as we continue averting HIV stigma in our country. Thank you, and God bless you. Bye bye.